Hi, my name is Stefan Georgi, and I'm here today with Dr. Mike Shwartzstein of BrainCore of Port Washington and Back to Life Chiropractic of Port Washington. Today, we're going to talk about adult ADHD and how it can be different than in ADHD in children, as well as some of the science behind ADHD in general, how it affects your brain, and then a few of the therapeutic alternatives to traditional medications and drugs that can be applied to ADHD in both adults and children. So, I guess yeah, the first question for you, Dr. Schwartzstein, is what are some differences when it comes to ADHD in adults versus ADHD in children or young people?
Well, the symptoms aren't necessarily different, but oftentimes it'll be more apparent in children because they're in school and they're being monitored constantly, and so um, since they're under scrutiny always, when they're not able to focus, it's very apparent that that there's an issue because
Sure,
they're not performing the way the other kids are.
sure.
Oftentimes, yep.
And what
And
about
but in adults, it's like, um, you know, if you're your own boss, it might show up in like things not getting done on time. The bills aren't getting paid. Things aren't going as smoothly as they could be.
sure?
Different responsibilities for adults versus kids, so it'll show up differently in their lives.
Do you think that sometimes, as an adult, especially having ADHD, can then be linked or associated to sort of a sense of anxiety? Maybe not like a clinical anxiety, but just because you're not getting things done, that can sort of as a side effect. I was actually thinking about this as we were preparing for our conversation, and I was wondering what your thoughts were.
Oh, absolutely. If you're not able to focus and you're in a job that requires your focus, I could very much imagine that that would cause a little bit of anxiety,
Sure,
which could eventually lead to a little bit of depression if you're not performing the way that you should be and your colleagues are.
sure. So it's kind of like a slippery slope in a way. I mean, not. And again, I'm not trying to be causal and that this causes this,
No,
but there's
absolutely
certainly
not. But you could see how that some of these things could be related to each other.
sure, absolutely. So maybe if you could give us a little bit, because what's cool is you're with BrainCore Therapy, BrainCore Port Washington, and BrainCore provides neurofeedback and what they call QEEG biofeedback. But essentially, what you guys really focus on is how the brain is kind of wired differently, or almost like it's just a little bit different, the activity going on in the brain for someone who has ADHD versus someone who doesn't. And I was curious if you could sort of explain that a little bit and kind of maybe even highlight what those differences are.
Well, sure. I mean, let me start off like how we would start in the office. We start off with a test called the QEEG, which stands for a quantitative electroencephalogram. And what this test shows us is how this person's brain is functioning. Once we have that information, we upload that information into a database that is full of hundreds of thousands of normative studies, people that reported no symptoms at all. And so we got a baseline on what does a quote unquote normal brain look like, right? And we compare and we see the differences. And oftentimes, what'll show up is if someone has been diagnosed or not even diagnosed with ADHD, we'll see that their theta brain waves are, when they try to focus and use their beta wavelengths, they reverse each other. So when you're trying to focus and beta is the wavelength associated with focus, instead of that happening in the person's brain, what happens is theta elevates, and theta is the brainwave that's associated with falling asleep. So the more this person's trying to focus, the more their brain wants to go to sleep, and so that could be an issue. And this is one of the reasons why when you give someone that has this issue a stimulant medication, it wakes the brain back up and it gets the person's brain to produce more beta. Now, that's all good and great, but what if that medication is causing some kind of other symptoms that are less desirable than focus? So, um, So we like to focus on a drugless approach to making the brain do the exact same thing, which is produce more of that focused brainwave.
Cool.
And BrainCore therapy is a way that we could do that. So once we've determined what's going on, if there's a problem and where the actual problem is happening within the brain, then we could target the treatment to address that specific area.
Cool. Yeah, and that's huge, and especially, I mean, I know because I've been diagnosed with ADHD and I've been on concerted Adderall, things like that, and not only do those drugs, I mean, I'll focus all day, so much so that I forget to eat and feel like I'm on, crack or something. I mean, that's extreme, but it really it can be awful and it can be life-changing, both in kids and as adults, because you don't want to change, the fundamentals of your personality. What you really want to do is just be able to have that focus and address what's causing the ADHD. And I think that's what is exciting about neurofeedback and BrainCore. And so just in a little more detail then with BrainCore and how you can help once you've determined the patterns and kind of what's going on and referenced it against your database. What exactly does neurofeedback training look like? For me as a patient, if I come in with my ADHD and we've gone through everything, we know I've got it, we kind of know what we need to address on a brain level.
Okay.
What's the next step?
What was that? You broke up?
Just what's the next step after that as far as
so once we determine the protocol and how we're going to approach the problem, and we've determined where in the brain the dysregulation is happening, we'll put a sensor right in that area, and that sensor picks up on the brain activity and sends that information into the computer, where the computer interprets it and ties that information to a cue such as a movie or a video game. And when the brain is moving towards a more orderly pattern, the movie will play clearly and brightly. And when the brain is moving away from an ordered pattern, the movie will get dim and the volume will diminish. So the brain wants to watch this movie brightly and clearly and hear it that way. So it will strive to do what it needs to do in order to make that happen, which is produce a more orderly brainwave pattern.
Cool. Wow. So you're kind of conditioning your brain in a way. Then would you say, is that fair?
Yeah, that's a fair statement. So it's using real-time information to train the brain to act a certain way, and the more that it acts that way, the better it gets at it. New neural connections are made within the brain in those areas, and when that starts to happen, our patients start to report a diminishment in their symptoms, and they start to refer all their friends because of the amazing results that they're getting.
Sure. And you do see a lot of good results using neurofeedback for ADHD in adults and kids too?
Most people that come to see us report an improvement in their symptoms.
Awesome.
I don't have exact numbers, but I see a lot of smiles in my office.
That's awesome.
Yeah.
And so in order to get more information, there's a couple different ways. Dr. Shwartzstein is part in BrainCore of Fort Washington, or part of the whole BrainCore of New York group. So you can go to braincoreny.com. If you go over to locations, you'll see they're Back to Life Chiropractic. So again, braincoreny.com, and if you do the / it's back-to-life-chiropractic. Again, you can just find it by going to locations. But go ahead.
And it's also pwchiro.com.
Perfect, and that's a lot easier to maybe remember that. So either way, what I would recommend, and I work with the different kind of BrainCore groups, and I just hear all these stories and see so many successes all the time. And I would recommend that you go to one of these two websites, it's pwchiropractic.com or BrainCoreny, and just contact Dr. Schwartzstein's office and see, schedule a consultation. I imagine the first consultation is normally complimentary, right?
Yes.
Your phone? Yeah. Okay.
I had to ask my wife about that.
Yeah. So I mean, whether that's even just like a phone call, or I don't know how you guys specifically do it, but I would call and schedule something and just talk, because I know not everyone is a candidate for neurofeedback. I know you guys are somewhat selective, but I know that for the people that you work with, it really makes such a big difference in their lives. And if you've struggled with ADHD or really a lot of the neurological conditions, and you're tired of medications and drugs, or you really just want something kind of that seems more long term instead of a quick fix where if you forget to take your medication for a couple of days you're off the walls again. If you want something that can really fundamentally help you to change the way your brain operates, I'd really recommend visiting them online. So Dr. Schwartzstein, thank you so much for taking the time to speak with me today.
And thank you. Have a great day.
You too. Thank you.
Bye.